Welcome back to season 3 of the Level Up Infection Prevention podcast. I'm Michelle Strange, and I'm so excited to have you join me as we dive deeper into the nuances of infection prevention and patient safety. Today, we're going to be tackling eye protection. Probably for both the provider and the patient. I think it's a topic that's so important in creating those safer dental visits. And I'm thrilled to be joined by Leslie Canham, who brings a wealth of knowledge and practical insights to this audience today. So welcome so much, Leslie, for coming on.
Thank you for having me, Michelle.
Absolutely. I would love to dive into this topic and let you be our leader here. So, what are some things or concerns we have if we are not wearing our patient safety, our protective eyewear?
Well, Michelle, both you and I visit dental offices while they're seeing patients as part of what we do as infection prevention control consultants. And I can't tell you how many times I see either inappropriate protective eyewear or no protective eyewear for team members who are performing clinical tasks. And that's everything from providing patient care to processing instruments. And it concerns me a great deal because I have some information that I received from a person who has actually had an eye injury, a dentist, Dr. Peter Arsenault. His studies revealed that 70% of dentists experience some degree of ocular trauma throughout their entire career. And many times it's because they're not wearing appropriate protective eyewear. So when I see people working with patients who are wearing eyewear, but maybe not necessarily appropriate protective eyewear, it's concerning to me. As you know, we have two eyes, and when you lose your sight in one eye, it makes your depth perception in a way that you may not be able to deliver dental care or do other things that you're used to doing because you simply can't focus and do what you need to do to be able to deliver dentistry or again other things that you might enjoy doing in your life. One of the concerns that I have is that it's the not wearing the appropriate protective eyewear, but then it's up to the employer to provide that appropriate protective eyewear. The right message comes from the top, and we have buy in from the leaders of the practice when it comes to personal protective equipment. Everyone else will follow in line.
And I think we have to be real clear too that it's not loops. You don't get purchased loops just because you wanna have loops as your protective eyewear, right? That's not what the employer has to do. But they have to be able to give you something that is going to truly protect your eyes.
That's right. And what seems to be the concern these days is that in the past, when it came to OSHA standards, and the standard for eyewear is 1910.133. So if anyone wants to go look up the OSHA standard, OSHA relies on ANSI standards for some of the nuances and some of the studies and testing that are conducted in order to demonstrate that something is appropriate. And the new ANSI standard actually brings into the language appropriate protective eyewear and deals with something called the bottom gap. And the bottom
Mm.
gap is the space where the safety glasses and the user's cheek is. And today, what we're finding is that bottom gap allows debris, blood, or other potentially infectious material to get to the wearer's eyes. Now, with appropriate protective eyewear, many of us are wearing face shields because during COVID, we found that face shields were providing us better protection and allowing us to extend the use of an N95 respirator by keeping it cleaner from splashes and spatters. And when I talk with folks who have switched from protective eyewear to a face shield, they tell me that it's amazing what collects on the outside of a face shield and that they had never realized how much they have been pummeled with everything with that close proximity. You think about it, your face is the biggest piece of real estate besides your hands that are right up there next to a patient's mouth. And when you add rotary instruments and aerosols and debris, it can be for hygienists, it can be prophy paste or chunks of calculus or tartar. For dentists and dental assistants, it might be restorative materials. And oh gosh, I had one client who was wearing loops. You mentioned loops. He was wearing loops and he was sectioning a bridge, and a piece of porcelain managed to get past his loops and embed in his eyes. And he said that was just the scariest thing that ever happened to him as a dentist. And he remembers being in the emergency room thinking that, oh, he hopes he doesn't have permanent damage as a result of this.
Seriously, though. And I definitely started with I did not start with loops as a hygienist. I started with the face shield and then I got loops and then I could not wear my face shield. It didn't fit over my loops anymore. And I think one of the best things that did come out of the pandemic for me was a lot of HBE tips options for me, but also a face shield that extended past and actually worked and functioned for me. It was the best thing that came to me because of the silver lining, if you will.
That's right, and we come up against adversity, and there's always innovation that tackles that, and I know that there will be more and more innovation and devices that will help us protect our eyes. But at this point in time, looking at how we would resolve the bottom gap and how we would make sure that not only do we have solid side shields, but we have a brow guard. I remember a hygienist telling me about an experience where she had a little bit of prophy paste that behind her brow shield or brow guard on her safety eyewear and actually landed on her eyelash. And I remember her saying that if I had not blinked at that particular moment, that might have gone into my eye. So it's not just dentists, it's hygienists and then dental assistants. If you can think about the position where a dental assistant sits next to a dentist when a dentist is prepping a tooth, you can see how we could have all sorts of debris that could fly at us from the side as well. So, uh, appropriate protective eyewear that wraps around well. I like the kind of eyewear where there's a gasket where you actually, and again, another innovation that we have seen that sort of transferred over from, I want to say, those guys that wear skydiving glasses where they have the gasket around it and it sits firmly. But I've also seen bicycle riders who are out on the road and they come across everything from gravel to bees and other things on the road where they have a gasket all the way around. And so, what better protection could that be than having that type of availability to cover your eye? So, any way that we can look at making it safer and then getting the word out there. And as consultants, we are constantly talking about protective eyewear, not only for ourselves, but for our patients as well. And I remember you and I both belong to an association called the Association for Dental Safety, formerly called OSAP, Organization for Safety, Asepsis, and Prevention. And several years ago, we had a guest speaker who was a young lady who had an experience in a dental chair. She was not wearing protective eyewear, and she had a very severe eye injury that cost her eyesight. And for those listeners in this podcast, her name it was Jen Marone. And she actually has a couple of YouTube stories that you can Google her. Her name, Jen, is Jen, and I believe the last name is Marone. And she spoke to our group describing her typical visit at a dental practice where she had gone to have a routine root canal. She was anesthetized, and she described the assistant and the doctor were handling the syringe. The doctor apparently was passing the syringe over her face. Somebody fumbled, and the syringe fell out of the hands of the dental worker, landed needle first in her eye. Well, she suffered a very severe eye infection, and as she described it, it was not necessarily an infection from just any infectious agents you might find in a dental office. It was a staph bacteria, so it was from her own mouth to her own eye. And she later, after the dental visit, had to be admitted to the emergency hospital where she suffered all sorts of eye wash procedures to try to eliminate the infection in her eye. And apparently the infection was so bad that it required removal. So her today she has a prosthetic eye or a prosthetic plate on her eye, something that actually looks very normal and very real. and you can't tell which is actually her natural eye and which isn't. And great advocate for patient safety when it comes to protective eyewear. How many times do we have patients that sit in the chair and decline to accept the protective eyewear that we offer them?
Oh, there's not a day where they would ever sit in my chair and not wear that. Like, that's the part, the declining part to me is I cannot do this work if you're not wearing the proper safety eyewear. There's just I would not.
That's right. And no, you really can't blink fast enough from a falling object. It may be an instrument. It may be the type of different chemicals that we use in restorative procedures where that could really be corrosive, maybe cause irreversible eye damage. And then it even just the roughness of perhaps prophy paste that if anyone can think of how it might feel, if it had a grain of sand get you in the eye and how uncomfortable that would be for a patient, how that could scratch their cornea.
And I just think of I have had some patients that are like, "Oh, no, I'll just close my eyes." I'm like, "But a needle could go through your eyelid." Like, in that situation with Jen, it's not just, "Okay, I'm gonna close my eyes and nothing's gonna spatter." Like, we have sharp instruments. Also, I think one of the things that I've heard a story about somewhere in the world was, like, the burr coming out of the high speed and it flying off. And, like, that your eyelid, I guess, will give you some protection, but, like, why do we chance it? Why are we chancing any of that?
That's right, that's right. So there's so many things that could occur in a dental setting, and not to scare patients who may be listening to this, but we work with a lot of different things that are sharp or that are toxic or caustic, and lots of things that hopefully we're under good control. But accidents happen, and we certainly don't want our patients or ourselves to be the victim of an accident that causes serious injury.
I totally agree. Now, you said that there was, like, some standards that OSHA follows. One of the things that I thought was interesting in one of the ADS courses was that we can't just use the plasticky type of eyewear as our preferred eyewear because it might not actually hold up to some of those things that ricochet out from a handpiece or something.
Certainly, you want to wear appropriate protective eyewear. And this is the employer's responsibility to provide appropriate protective eyewear. So, a little research into the various different types of appropriate protective eyewear for the task. And again, making sure we are mindful of the bottom gap. You mentioned that when you were wearing loops, that you had a difficult time having the face shield fit over the loops. And then there were different types of face shields that were designed to provide a little bit more room for the loops. I've also heard that sometimes face shields can create sometimes a glare, and that may be difficult for the provider to be able to really see well. As we go along, looking at the different types of eyewear that we could wear to protect ourselves, looking at the type of eyewear maybe that our team members are wearing, looking closely at, say, for example, I wear prescription glasses. And when I see people wearing prescription glasses, again, unless they're designed as safety eyewear, impact resistant lenses, solid side shields, brow guard, and then consideration for the bottom gap, they're really not appropriate protective eyewear. So something has to be done to protect individuals, and OSHA holds the employer responsible for providing this. So there's a great deal of liability that rests on the employer's shoulders when it comes to eye injuries. And again, in dentistry, it could cost us our career if we lose the sight of one eye.
And, I interviewed in this season Olivia Wan. So if you want to go to learn more about the legal side of this, and she also does the podcast with you that she brings up. And I had asked, so let's say I am the employee, I'm in this office, and I have been given a particular eyewear, but then I choose to use my prescription glasses and something actually happens. I was curious, could I even file a workman's comp claim? Because technically, I made that choice not to do that. You trained me, you provided it. Can I even make a claim? And she was like, potentially not, because you were trained and you made those decisions. But then my other thought is like, should I even allow if I'm the employer and my team is just making choices to not do that, is my liability even higher on that because they could get injured and now I gotta pay for that? Like, I'd be upset if I was an employer.
OSHA looks to the employer to be the leader and to
Yeah.
enforce the safety policies of the practice. And one thing that we can agree on is that sometimes people go rogue and decide they want to do what they want to do. And so what are the penalties? What are the sanctions in a dental office? What type of reprimand would someone get? I understand today, oh my gosh, with our workforce shortage, we don't want we don't want to run anybody out of our office. But working in a safe environment is a choice. And when someone chooses to cross the threshold of a dental office and work for a dental practice, they need to agree to abide by the rules and the standards of the office. We have certain policies. Maybe somebody that says, I'm always late. Tardiness is not an option. Sometimes things happen, but on a routine basis. I choose not to wear protective attire, or I don't want to wear a clinical jacket, it makes me too warm. If you choose to work for us, you choose to abide by our safety standards. These are those standards. We require this in our office. These are the policies, and you're welcome to find an office that suits you better if you want to work somewhere where they're not going to enforce safety. Because when we protect ourselves, we protect our practice. And you're right about the individual that says, I just want to wear my prescription glasses. I don't want to wear a safety eyewear or a face shield. It's lumpy, it's bulky. In that case, they're not protecting themselves. And I think from the patient's perspective, for those patients who know a lot about PPE, thanks to COVID, they know all about protective eyewear. They know all about how to wear a mask, how not to wear a mask. If they look at us and say, if they can't protect themselves, how can they protect me when I'm in the chair? And as far as liability goes, again, the employer certainly has an obligation to enforce the safety standards or the safety policies of a dental practice. So I think OSHA would be very concerned if an employer let employees choose what they want to do.
That's so true. And you're I've never known, and granted, I've been in the industry now since I was 17, like, just a babe. I don't know another real world outside of dentistry. But I have just never met so many self-sacrificing people. Like, your eyes are important, you seeing things is important, the way your hands operate are important. Take care of yourself. Like, it really I know that sometimes the perspective of infection prevention and safety and the things that we're required to do is a burden. It feels frustrating, feels annoying, but really if you, like, just adjusted that perception, like, you'd see that it's because you matter. Like, you matter, your sight matters, your body matters, and you really can't pour into other people in a healthcare profession unless you're filled up yourself. And so take care of y'all. Take care of you. It's so important.
Another thing that can happen besides debris, which is the big topic of the day with appropriate protective eyewear, is how flying debris could hit you. But if you think about if you've ever had pink eye,
Oh,
conjunctivitis, it's so uncomfortable. Not only does it look bad
yes.
and highly contagious, but it's so uncomfortable. And if you think about something hitting you in the eye causing an infection, how uncomfortable that would be for you and the potential other bad end that could come to any other sometimes infections can are difficult to knock down, and sometimes an infection in one eye can travel to the other eye, and of course certainly pink eye or conjunctivitis is contagious, so there's a lot of opportunity to infect others within your family and a patient population. And according to the CDC guidelines, that's one of the conditions that would prohibit us from being at work. It's called a work control.
That's okay.
I forgot what it's called, but it's
Work practice control? No.
work practice control, but it's something that where it prohibits. I can't remember what it is. Pardon me. I hope you'll edit that out.
Yeah, I can definitely.
It's one of the work conditions, one of the conditions that prohibits you from being able to work.
And I think that is also something that hits home to a lot of us dental professionals because we don't have a lot of benefits. Not a lot of these offices have PTO. As a hygienist, if I'm not producing, I don't get paid. And maybe we have a few sick days here or there, but I really don't want to use that just because I didn't cover my eyes, and now I have pink eye, which you said is so uncomfortable and miserable. And now the office is not producing, or they had to bring in a temp. And now I'm not making the money that I need to make. And like, how many days until that clears up? Usually it's not too bad with antibiotics, but like, you never know. And I think that's a sensitive subject for a lot of us that are working, uh, maybe not exactly paycheck to paycheck, but you got to work. And if you're not working, you're not getting paid.
That's right. That's absolutely right, and that's fair is fair. So, my dad's a dentist, and, we worked together. Again, I was 16, so actually younger than that when I started working for him. It was a funny story, Michelle, because, my mother told my dad that if he didn't take me to the office, that she was gonna kill me. So, I started
Get her out of here.
my dad started me in stocking the treatment rooms and refreshing the alcohol dispensers and the paper towels and cotton rolls and things like that. And I remember before we had personal protective equipment as a requirement with OSHA, and I'm talking early 70s when I was working, we didn't wear protective eyewear. We didn't wear surgical face masks. We didn't wear gloves. Clean fingernails was my dad's pet peeve. I had to have clean fingernails all the time. But I also remember hearing a lot about sometimes there would be splashes and spatters that would occur for dental workers, and they would suffer from something like ocular herpes, from oral cavity to the eyes. I remember myself when I was working chairside, and we were standing, mind you. We hadn't discovered four-handed sit-down dentistry yet, so I'm really dating myself here. But I remember it was warm, and we were on the 3rd floor of a five-story building in the San Fernando Valley, California, which could get over 100 in the summertime. And I used to lean into the cool mist of the hand
Oh,
teeth.
no.
It would fool my forehead, and I remember being pummeled with just different pieces of either tooth or amalgam or whatever, and I'd have to blink my eyes against it, and my dad finally said he finally agreed that maybe I should go get some safety glasses, and I went and some safety glasses. They were clear glass because I had perfect vision back then when I was a teenager, but they were impact resistant, and so I got through that phase, and then my dad finally had to tell me, he said, "Now that we've got your eyes covered, Leslie, you gotta stop licking your lips when you're working on patients." That was one of my nervous tendencies. We
The things we know now, the things we know now.
That's right, and how far we've come from where we were, and it's so important now that we have this OSHA requirement with the bloodborne pathogen standard to protect our hands and to protect our nose and mouth from splashes and spatters and to protect our eyes. Why in the world will we ever go back to what we used to be exposed to?
I totally agree, and I started an ortho where historically ortho I think is one of the worst when it comes to infection prevention things, and I did not wear a mask, I did not wear eyewear, and then I have always used an air powder polisher of some sort. So, Profijet back then, now I'm doing airflow. So, I have been exposed to crazy amounts of aerosols my entire career, and I wore just a terrible kind of mask. I could taste the baking soda throughout the day. Like, I think we can all be like, we haven't done it perfect, but I suffered a ton of upper respiratory infections. For whatever reason, I always covered my eyes because it's probably the only thing that actually works well on me is my sight organs. So I like to keep those as healthy as possible. But I think we know better and we should do better. I know that's not everybody's motto. Just because they know better doesn't mean they always do better. But I think if we can make these steps to protecting ourselves and our patient, and going back to pink eye, how angry I would be as a patient if I got pink eye from my dental office. I'd be so upset, especially if I had kids and stuff. Like, I'm now this highly contagious thing. Protect your patients, protect yourself. It is so critical. We create so many spatter sprays, aerosols, debris, chemicals that we use. It's so important.
Absolutely.
Leslie, is there anything else that we could add to this conversation today?
Well,
Did we cover it all?
I think everybody should be including eye safety when they do their annual OSHA training or doing their either monthly safety meetings, maybe even just a quick comment at the morning huddle. Make sure we're not only protecting ourselves with appropriate protective eyewear, but protecting our patients. And overall, we're protecting our practice. So, employers and practice owners should make this a regular part of their conversation, reminders, and make sure that team members are aware of the hazards that could occur to their own eyes and to their own well being.
No, so perfect. Thank you very much for coming on and helping us better understand this topic. I'd love for you to tell us where people can hear more from you, learn more from you, follow you, all of that.
Oh, of course. To contact me directly, I'm Leslie Canham, Canham. My website is lesliecanham.com, and you can see in the banner behind me how it's spelled. I also do have a podcast like you do, podcast with three of my friends who are also infection prevention and control consultants. Olivia Wan, who you mentioned, Mary Gavoni and Linda Harvey. We have a podcast that we formed early in the days, the beginning weeks of the pandemic. We call ourselves the Compliant Divas, and so you can hear our podcast from your favorite podcast channel or from our website compliancedivas.com.
Perfect. Thank you again for coming on. I appreciate your expertise today, and I'm sure everybody else does as well.
Thanks for having me, Michelle, and I look forward to seeing you coming up in 2025.
Thank you for listening to season 3 of the Level Up Infection Prevention Podcast. Don't forget to follow or connect with the guests. And while you're at it, follow me on Instagram, Level Up Infection Prevention. And check out levelupip.com for more details on all the digital courses and the Infection Control Coordinator's Guidebook.